This is the tabletop suction machine, or you can call it as a aspirator, mainly used for post-surgical treatment of patients who had undergone ILD, patient with asthmatic conditions, and people who suffered from cancer and all that. They have a lot of people who undergone tracheostomy. They can use this tabletop. This is basically a home use product, and it can be of course used in any clinic or by any doctor in the hospital, but generally it is used by patients at home. Okay, as you can see, this weighs around 4 to 5 kilos and very easy to transport. It can be kept on a table, hence it is known as a tabletop suction device or a tabletop aspirator. You can see the vacuum gauge here. As I told you already, the gauge moves from in an anti-clockwise direction because we are measuring the negative pressure. Normally any gauge, a speedometer, anything you take, it moves on a clockwise direction. Because it's measuring the negative pressure of the fluid, it moves in an anti-clockwise. That's why it is given in red. Okay, and here we have the controller to control the negative pressure. That is, negative pressure is given in mmHg or kilopascals. Now I will show. This is provided with a polycarbonate bottle which can be autoclaved at 121 degrees centigrade, 15 pounds per square inch, and this is a 1 liter bottle. We have the lid here. As you can see, one end is marked patient, another end is marked vacuum. Okay, I will tell you how to fix the tube. And inside, please do not forget to put the floating valve. Okay, this valve like this. The black side, that is the rubber end, should go to the top. Okay, to the top, and close it tightly. Now we are closing the bottle. Now it is ready for use. We are going to keep it here. Keep it in such a way that the doctor or the user can see the markings here, the calibrations here. Okay. Now we are provided with a bacterial filter. I'll tell you how to fix it. Put one end of the tube to the side mark, to the port that is marked as vacuum. Okay, and the other end to the port here. Now please take the tube that is provided to you. This is also provided along with the kit. Okay, this end of the tube has got a connector here. It slides smoothly inside where it is marked patient. Please push it inside. Now, and the other end once again has got, we are providing a connector. There's a blue one is a connector. This can slightly go inside, and this end can be connected to any size of catheter, whether it is for pediatric or adult or geriatric. So the doctor will decide. The caregiver knows what is the type of catheter that has to be put at this end. In case you are using a yonker, remove this and directly connect it to the tube end. Now, instead of a patient, we are using a bucket of water just for demo purpose. I am pushing it inside. Let us start. You can see the vacuum gauge rising up to 600 or 650. Now it is full, and the floating valve will prevent the water from entering through this into the motor. If it gets into the motor will become faulty. It can never be used. You have to replace the motor, which is going to be very costly. It is as good as buying a new machine. So care must be taken that once the fluid reaches this much level, please put it on manually. It doesn't have a sensor to stop it automatically. Okay, so that's all. And this can be used for pediatric, geriatric and adult. Depending upon the age of the patient, the controller can be set. Okay, this is the maximum. In case of pediatric patients, we can use it up to 200. Just raise it or lower it in such a way that the needle comes and stops at 200. As simple as that. Once the work is finished, please remove this This can be taken to a before starting, we would advise you to fill up this bottle with 50 ml of water with a few drops of Lysol or any antiseptic fluid, like Dettol, Savlon, because the fluid that is going to get collected may be infected. This is to safeguard the cleaning boy or a girl from getting infected. That is advice. And moreover, if you are taking phlegm, it is, as you know, it is very viscous. It gets stuck to the, maybe they don't clean it well. So if there is water, it slightly dilutes it and it becomes easier for cleaning. Thank you.